Over the last 24 hours, we have identified 2,370 new cases of COVID-19 and completed 7,338 tests. Our positivity rate for lab-confirmed cases is about 34%. With respect to the more than 2,500 schools in the province, Alberta Education has confirmed that as of February 2nd, 19 have shifted to temporary at-home learning to address operational challenges. Of these schools, 4 have fewer than 40 students total. Across the province, less than 1% of schools are currently operating online. Looking to hospitalizations, there are currently 1,584 people total with COVID-19 in hospital, including 112 in the ICU. Sadly, 15 new deaths were reported to Alberta Health over the last 24 hours. My sympathies are with their loved ones and every Albertan who has lost someone they cared about, no matter the cause. My colleagues in other provinces which are farther ahead in the Omicron wave and where hospitalizations are declining have been speaking publicly about the fact that we need to plan and move towards a different way of managing COVID. I agree with my colleagues that this is the direction we need to move when we see similar trends in our acute care system in Alberta. This is a shift in thinking that can be challenging, given that we have needed to use extraordinary tools at our disposal over the past several years to protect our health system and our communities. What I want to be clear about is what moving to endemic means. COVID will not go away. There will continue to be impacts on our acute care systems that will rise and fall with seasonality and new variants that may emerge. We cannot prevent all negative outcomes from COVID, and we must be ready to respond to new information. What has been important throughout the COVID response is seeking balance between the harms of COVID and the harms of the measures needed to prevent an overwhelming surge of severe outcomes. I believe that after the Omicron wave has subsided, the risk of our system becoming overwhelmed will be substantially reduced, and this will enable to shift our response. This change will take time, and we need to continue monitoring severe impacts and any changes to the virus. But we cannot continue to use restrictions in the long term once the risk of system overwhelm has passed. Our acute care system is still under strain today. We need to continue to protect it, and by extension, all of us. However, it is also true that in the future we will be able to remove restrictions, and indeed we must continue to balance our response to minimize all harms across all areas. The pandemic has never had one single right way to respond, but what is always true is that the actions that each of us take every day matter to our communities. The restrictions exemption program was put in place in September in the midst of our fourth wave with a dramatic surge of Delta, which was causing very significant strain on our acute care system, in particular in ICUs. We saw that with the implementation of the restriction exemption program, our vaccine coverage rates went up very significantly as there was added incentive for people to get the protection that vaccine offers to those who receive it and to those around them. We also saw that in those locations that had the REP implemented, there were reductions in the risks of transmission because of the fact that those who were in those locations were fully vaccinated or had that recent negative test. So the restriction exemption program has certainly had a significant beneficial impact. We know from our current data that Omicron is escaping both previous infection protection and vaccine protection at greater rates than the Delta variant did. But we also have seen evidence that having 2 or 3 doses does minimize the chance of onward transmission in someone who has a breakthrough infection compared to someone who is unvaccinated. So there is still benefit in ensuring that we are protecting our communities through vaccination. What we've seen is that the protection level that 2 doses of vaccine offers against infection with Omicron has fallen. So depending on how long it's been since that second dose was received, at about a 6-month time frame from when that second dose was received, there's not a lot of protection left against a person getting infected with Omicron. Thankfully, there is still a level of protection against severe outcomes. So that person who has 2 doses is less likely to go on and need hospitalization or have other severe outcomes. However, again, they can get infected. There is a reduced chance of that person with 2 doses passing it on to others, but that protection is enhanced when you look at 3 doses. That boosts protection up to about 60% level of protection against infection with Omicron, and boosts the protection against hospitalization to 95%. So again, vaccines are still important. That 3rd dose is particularly important with Omicron, and even the 2 doses help against severe outcomes.